Hi everyone, this is Srikanth. Now I am going to explain the chapter name, that is kidney, which was come under the excretory system in the BMS first year according to the NCISM syllabus. Now we are going to the search and we have to go through the what are the concept are the important in this chapter. First one, the kidney. The kidney we need to write in the examination. There are some subheading itself enough for the BMS according to the NCISM syllabus. If you wrote those much points, it's enough, because according to NCISM, if you read them a must know concept, that enough to score more, because there is only 2 or 3 maximum 10 marks questions are there for the must knowns, sorry, desire to know and the nice to know. Other all the questions and including MCQ also come under as a must know. Now we are going to teach the kidney chapter. Wherever the important concept and the subheadings are there, we are going through those things. That's enough. If you gone through these notes, it more than enough, because I prepared as like which is important according to NCISM must know concept. Because according, if you want to read for the board exam, like the your state board, means you are the student of the BMS, no? That's why according to your board, means in the Karnataka RGSS, in the Maharashtra there is so much university that you got MHU, etc. is there. According to there, they will follow the blindly according to NCISM. They follow the NCISM as a blind, because it is a holy book for everyone to follow. Like that, I follow. That's only. That's why NCISM syllabus is enough. First, we are going to the subheading. What are the important for us? Kidney introduction, synonyms, functions, and the shape, and whatever concept we are going to the subheading which are important for our classes. That's enough. More than that, you no need. Also, if you want to read more and want to gain more knowledge, go to the BDC and make your notes. That's enough. But my notes is enough for the all the university. Weight, location, external features, the relations of the kidney, and the posterior relations of the kidney. There are the two relations, that is the anterior relation of the kidney, posterior relation of the kidney. We go through those points individually in the later session, but we are going to the subheading now. That's why I'm explaining that. Capsules are covering of the kidney, means the outer covering of the kidney there now. That's why. Next, what we call go through the macro structures of the kidney. Later, after the what we call histology. These are the enough find for our university. Now going to the each and every find. If you want, I will give these notes. It will be in my link. If you want these notes, means text me in the comment section. I will send to the I will send it. Okay. Go through this once again. Yeah. First one. Going. Hi. Once again, I will introduce myself. I am Srikanth. I am studying as a BMS first year student. That is enough for my what you called introduction. Now going through those. Kidney introduction. It is an excretory organ. I already suggested you and already I told that kidney is an excretory organ. It present in the posterior abdominal wall, where like if you are like that. This is a person, na? In the posterior wall, it was present. If the person is like that, it is the anterior structures. It is the anterior structures, and the behind that is there the posterior structures is there. In the behind wall, that is present. Okay, na? Next, going to the next. Okay, erase it. Sorry for your disturbance, students. Next, behind peritoneum. We are going to next topic, that is a not going to the next topic, but it is a synonyms. What we called in the another name of the kidney, that is a renal. It was a come from the Latin word rens, and the nephron. That is a nephron. It is a what we call the number of nephron is converted into the kidney contained one kidney. There are the 2 kidneys present in our body. The one kidney contained the 3 to 4 millions of the nephron. The functional and structural unit of the kidney itself is a nephron, because whatever the things and whatever the need we need for the functioning and the structural unit of the kidney, now that all the functional and the structural work is done by the nephron. That why we called as a structural and functional unit of the kidney is known as a nephron. That's why the nephron name is comes from the nephros. It also the Latin word. All words what we come to know in the BDC or any textbook, those all the things are the Latin word, because before the what the modern textbooks are written, they are the completely based on the Latin words, and the some old modern technicians and the old modern doctors are the preferring those names in those era. That's why the functions of the kidney we are going the ultrafiltration, because it's the main filtration. It was working as a filtration, because when the all the things water what you call the water, it will become in the kidney. The kidney going to purify the things, because it absorb the mineral things and the the waste materials is present in the water, it leave it and it transport as a urine. This like that it is a filtration in the kidney happens. Okay, the conserve the body fluids and the electrolytes. And I already said like that it absorbs the minerals and the body main the whatever the content and the need for the body, it will absorb it and store in the cells of the kidney, and it will it will transport into the body fluid and electrolytes. Whatever the body fluids and the electrolytes are required for the body, it will absorb it and transport to the heart and distribute it all over the body. Like that the function will be happen in the body, the maintenance the balance, it will maintenance the normality of the body, like the temperature, everything, because the water is the only content which have the so much things. If you don't drink the water, there is a so much imbalance in the body, the metabolism is not proper in the body, and if the water will become in the kidney, it will purify it and maintain the body as a good health, and main content in the water it will absorb and transport all over the body and maintain the normality of the body, and like that it will be the maintain the balance. Kidney is the endocrine gland. There are the two types, endocrine and exocrine. What will be done the work done by the endocrine is mean the hormonal secretions, and the exocrines means the some hormonal what is normal, not hormone, it's like other functions. Only two pancreas only act as a two types, means pancreas act as a endocrine and also as a exocrine. Next, erythropoiesis, formation of RBC. Okay, it is a main function here, means it work as a erythropoietin, means formation of RBC. What is the formation of RBC? The formation of RBC we already know that it also form in the liver also. Liver is one of the main organ where the RBC will be formed. In the kidney also there is a formation of the RBC take place. Renin is present in the kidney. It will do the function as angiotensin to angiotensin. Angiotensin means it work as a blood pressure, means in the body the pressures are required for some pressures are there in the blood pressure, are the main blood pressure maintenance is so much important, because if you're not maintaining the blood pressure, it will cause to any disease like what you call something happens, some disorder maybe happens because of the blood pressure. If you not maintain the blood pressure, it will cause any disorder. That's why the maintenance of blood pressure is so much important in the body. Vitamin D3. Vitamin D3 what will do? Means 25 hydroxy vitamin D3 converts the 1,25 dihydroxy vitamin D3. In this, one hydroxylase is required enzyme. Means in the vitamin D we see the here vitamin D3 means vitamin D3 is present in the kidney, but when it will combine with the 25 hydroxy, it will convert into 1,25 dihydroxy vitamin D3. by the enzymes of the 1-hydroxylase. Okay na. This vitamin D3 is important for the maintaining the normality of the body and the shape is a bean like shape. We already know the kidney shape is like that, everyone know na. And it is color in the reddish brown. Length means if the kidney is like that, the length, what you call that is length, is a 11 centimeter. Okay, the breadth is a 6 centimeter. And the thickness, what the 3D diagrams we need to draw for the thickness of the kidney, like that. The thickness might be 3 centimeter. Okay, I will give the tricks for the size. 3 2 ja 6, 6 3 6 2 ja 12, 6 2 ja 12. Okay, one more we are, and because the left kidney, we have to remember this also. What things we have to remember means the left kidney is 1.5 centimeter more than the right kidney. The left kidney is 1.5 centimeter more than the right kidney. Add one, that leads to 11 centimeter, means the thickness is a 3 centimeter and the breadth is a 6 centimeter and the length is a 11 centimeter. Remember this because it is so important for the examination. Wait, in the male and the female and the male, there is a difference in the weight of the kidney. Weight of the kidney in the male, it's the 150 grams. In the female, it's reduced from the 15 grams, that is 135 grams in the female location. If you draw this diagram is enough, because if you want to write so much content, now there is a lack of time. I will tell like that only, because if you when go to the examination, there is a lack of timing, because I am also wrote the examination in the colleges now. When I am going to write the examination, there is a lack of time. It is not about your talent, it about the time management in the examination. There is only 3 hours in the BMS examination. If in the 3 hours, it will be the so much, what we call that, so much frustrations and so much pressure in our mind to write the answers. If you go on writing one questions in the depth, it lack your marks and it will leads to failure also. That's why I will suggest more in anatomy, more focus on the diagrams itself, because the evaluator what will do, they only focus on the what you called the diagrams what you should write, because in the examination no one has so much patience to see the all the theory parts. But don't write in the paragraph manner. I will suggest to don't write also, don't write in the paragraph manner. If you are the 12th student, you are the new for this college BMS course, I will suggest you write in the what you call points manner. That is a good manner, that is a good. If you wrote in the paragraph manner that leads to so much time and that will cause us to your failure also. I will suggest you go like in the paragraph manner, do go in the what you call points manner. That is enough, because the examiner will like your points. They will not go through all the theory parts what you wrote in the paragraph manner. It will cause so much what you called irritate to the evaluator. What will the evaluator do? Lack patient and they will reduce your marks. That's why I will suggest draw a diagram and small flow chart, any required flow chart, that enough. More focus give in the anatomy, give focus on the what you call diagrams. That's it. You don't go through any more, you go through any all the theory points in the when you go to retina. That's then don't go theory don't write the theory parts more in the examination, because it may crack your time, that leads to failure. I'll suggest you to go through flow charts and the diagrams. That's it in the BMS or any medical college and any degrees. Okay, there are the 9 quadrants. Come to our syllabus. There are the 9 quadrants: 1 2 3 4 5 6 7, 8, 9. In the what you call the epigastrium, epi means upper, epigastrium, hypogastrium. The middle is the umbilicus. This is the landmark. Okay, above the umbilicus, epigastric. Below the umbilicus, hypogastric. And the right side of the umbilicus, right lumbar. Right side of the umbilicus, left side of umbilicus, left lumbar. And the right side of the epigastrium, right hypochondrium. And the right side of the left side of the the left side of the epigastrium is the left hypochondrium. The right side of the hypochondrium is the right iliac crest, and here the right iliac fossa. I will write right iliac fossa in the left iliac fossa. Okay, that's it. And this line, when we go to the body now, like that body is there, and there is the clavicle is present in here. The clavicle is passed through the middle of the clavicle. We pass the line, that is a mid clavicle. That is, this line is called as a mid clavicle. Okay, I will show this line, what you call now, this line now, what you call this line, this is the mid clavicle line, and this line is the this line is called a transpyloric, and below this line is called as intertubercle pair. External features, we are going through that. The kidney contains the two poles, two surface, two borders, and the hilum. The two poles are the superior and the inferior. Superior means above, inferior means below. Superior means above, inferior means below. Okay, anterior means front side, posterior means black side. The anterior part is irregular and the posterior part is a flat. And the medial surface is and the two borders, that is the medial and the lateral border. Medial border is concave surface and the lateral border is a convex. Hilum is a hilus, also called as a hilus. This diagram is so important. The relation of the kidney, anterior relations of the kidney. Anterior relations of kidney, these are the what you called the posterior relation, anterior relation. Go through those. Okay, the remaining are the capsule and some of the macrocycle and the minor and the histology is remaining. We are going through those things. Okay, see this relations of the kidney. The anterior relations, the right lobe of liver and the right is suprarenal gland, left suprarenal gland, spleen, stomach, pancreas, left colic, spleen. Left colic is also called as the splenic flexor, and the right lobe is also called as right colic is also called as a hepatic flexor. Remember this. Left colic is also called as a splenic flexor. Right colic is also called as a hepatic flexor, and this is a part of jejunum. In the right jejunum, in the left kidney there is a pancreas is present, stomach is present. In the left kidney there is a skin, what you called, go through this once again, wait. In the left kidney, left suprarenal gland, spleen, stomach, pancreas, left colic, it also called as a splenic flexor. These are present in the anterior relations. In the anterior relations of the right kidney, right suprarenal gland, right lobe of the liver, jejunum, right colic, it is also called as a hepatic flexor. Focus on these two, because these are two different. Left colic is a splenic flexor, right colic is a hepatic flexor. And the posterior relations of the kidney, the posterior relation of the kidney in the right side, it is subcostal with what you call sorry for the misconception in my spelling. in the talking. Subcostal vessels on the narrow, transverse abdominis, quadrus lumbaris, iliogastric nerve, ilioinguinal nerve in the another fossa misera in the right kidney. In the left kidney there is a subcostal vessels and the 11th and 12th ribs. And the capsules are means it is also capsules mean the covering. You know na, some capsule fruit are there, means it is a covering like structures. It cover the fruit, it's cover the fruits, okay, like that. The capsules are present in the kidney also to cover the outer surface. It helps to maintain the protective sheet, means it will work as a protective sheet for the kidney. It is so important for any organs. Like for the lungs it is like a pleural layer. For the stomach, what he called parietal layer. For the abdomen is like everything is required for protection of the organs. It mainly required for total outer for total in to covering the inner surface organs. The skin is so important like that. For the surface, for the protection of the kidney, capsules are the covering of the kidney is also important. It contains the costodiaphragmatic axis, 12 ribs, kidney and the fibrous capsules and the 3 coverings. And these are the just diagrams. Draw it and practice, that's it. Only there are the 4 covering of the kidney, that is the fibrous capsule. We are going through this. These are the 4 capsules covering, that is fibrous capsule, parietal fat, renal fascia, pararenal fascia. Fibrous capsule is inside, parietal fat is outside, means it is away from this, okay. And this fat, what we call, this is fat, parietal fat, renal fascia and the pararenal fat. Fibrous capsule is a thin, parietal fascia is the thickest and border of the kidney, okay. Adipose is also present in the parietal and the perinephral fat. And the renal fascia is a dense connective tissue and it is so hard, means dense means hard. It is connective tissue, means it will connect to those so much things, and it is a connective tissue. And it is also like elastic, means if it is like a stretchable, and it is cover the suprarenal gland, kidney and parietal fat also. Renal fascia is 2 types, fascia of Zerota, fascia of the Zucker kid. And the pararenal fat, that is a paranephritic fat, is the posterior of the posterior. Pararenal fat is a posterior. Pararenal fat is a posterior. It present in the posterior surface of the kidney. Like it is anterior, it is a posterior, like that. Macroscopic diagrams, macroscopic structures of the kidney. See that the renal columns. Okay, renal columns. This is the renal columns. The space, what you call the renal columns. The renal singles, what you call renal cells. Medullary pyramid. These are the medullary pyramid. These are the renal, what you call this, renal papillae, pyramid. And more capsules and the minor. These are the major capsules. These are major capsule, and these are the minor capsules, small. All the minor capsules are joined to form the major capsule. That's why this is the ureter for the urination, and this is large. This large is called as a pelvic, renal pelvic. Okay, now next go through this renal cortex, renal columns, renal papillae, renal pelvis, and the minor calves, major calves. Okay, go through these ones. We will go. Renal cortex. Renal cortex is the outermost internal layer, reddish brown in color. Renal cortex. See this. It is not present in this diagram. Go through some diagrams in the BDC. That's enough. The renal cortex is the outermost internal layer. It is the reddish brown in color. Renal column is the portion of the cortex extend between the 2 pyramids. The extend between I show in the diagram now. That is the diagram I shown in the diagrams. This diagram. Sorry. This diagram, in these diagrams all are present. You go through those terms and refer the diagram. It will easy to recognize the what are the things and the what are the terminologies. You come to know easily. And the last part of the kidney, that is the histology. Histology, the nephron diagram, if you draw now, that's enough. The histology, I already said like that. The structural and functional unit of the kidney is the nephron. You come to know this, the parts of the nephron, that is the junctional tubules and the DCT and the PCT and the afferent arterioles, glomerulus, DCT, descending lymph of the Enlis loop, ascending lymph of the Enlis loop, duct of Enlis, inner medulla, collecting tubules, cortex. That's enough. These are the flow charts regarding that transport and some clinical anatomy. Clinical anatomy is a renal pain and the palpation of the kidney, renal angle, trauma of the kidney, floating kidney, renal stones, pleura injury in the kidney, surgery, kidney transplantation and dialysis. If you wrote any 4 of them, it's enough for the examination. Thank you for watching. If you want any such beautiful content, please follow and share this video for any your friends for helping. Thank you.